How does urine cytology's microscopic exam help bladder diagnosis? Imagine catching tiny clues that reveal what's happening inside your bladder without surgery. That's exactly what urine cytology does. It involves examining a small sample of urine under a microscope to find abnormal or cancerous cells that might be shedding from the bladder lining. When cells become cancerous, they often change shape, size, and nuclear features, and these changes can be spotted by trained specialists called cytopathologists. The process starts with collecting a urine sample, which can be done by simply urinating into a container or through a procedure called bladder washing. The sample is then prepared, stained, and examined under a microscope. If the cytologist sees cells that look irregular or abnormal, it suggests there could be a tumor or cancer in the bladder. This makes urine cytology especially useful for detecting high-grade bladder cancers, which tend to shed more abnormal cells into the urine. High-grade bladder cancers are more aggressive and more likely to be caught early with urine cytology because these cells are more atypical and easier to identify. The test has a high specificity, meaning if abnormal cells are found, it's very likely there is a real problem. Its sensitivity, which measures how often it detects cancer when it is present, varies depending on the tumor's grade. For high-grade tumors, sensitivity can be quite high, sometimes over 80%, making it a reliable tool for identifying serious cases. However, for low-grade tumors, the sensitivity drops because these cells look more normal and shed less often, making them harder to detect through urine cytology. One of the biggest advantages of urine cytology is that it is non-invasive. It only requires a urine sample, so it's less uncomfortable than procedures like biopsies or surgeries. It also provides quick results and can be used repeatedly to monitor patients who have had bladder cancer before, helping catch recurrences early. But it's not perfect. Because low-grade tumors shed fewer abnormal cells, urine cytology can sometimes miss these cancers. Also, the interpretation of results depends heavily on the skill of the cytopathologist, and false negatives can happen. That's why doctors often combine urine cytology with other tests, like cystoscopy, which involves looking inside the bladder with a camera, or molecular urine tests that detect tumor markers. Using multiple tools together improves the chances of catching bladder cancer early and accurately. In summary, urine cytology's microscopic exam helps diagnose bladder issues by identifying cancerous cells shed into urine. It's especially good at detecting high-grade bladder cancers and is a safe, quick, and non-invasive method. Still, because it has limitations, it's most effective when used alongside other diagnostic procedures. If you're concerned about bladder health, always consult a healthcare professional for personalized advice and testing options.